Welcome to the Principles of Performance podcast, where we discuss how to optimize your health, fitness, and performance. Drawing on decades of experience of working as coaches, consultants, and trainers to top performers, athletes, and teams from professional sports to top universities to the U.S. military, Eric DeGatti and Mike Perry discuss topics and strategies of how to perform at your highest level and be your very best. Join us and our friends and colleagues who are leaders in the fitness and performance industry as we investigate and challenge the most popular training, nutrition, lifestyle, and recovery protocols. And away we go. Here we are with the Principles of Performance podcast. I'm your host, Eric DeGatti, along with my friend and co-host, Mike Perry. Mike, another edition of Where Pain, Performance, and Fitness Meet. And boy, do we have a gem with us today.
Yeah, we're pretty lucky for today. You know that saying, if you're, the smartest person in the room, you shouldn't be in that room. Well, I'm going to learn a lot today. Because I'm third on the totem pole between you guys. But no, today's guest is one of those guys that I just deeply respect and admire, and the way that he handles himself. And we're lucky to have him today. We're going to learn a lot today. We're going to talk some shop. And this is one of my favorite parts of the podcast, where we get to actually sort of just talk shop and sort of people can see behind the scenes how we as strength coaches, trainers speak with clinicians and what that communication looks like.
So let me introduce you to our guest. If I want, this bio is going to take forever, so just go in the notes and read most of it, because every letter you could think of, he has, right? If I could just sum it all up, in our talks, Mike and I talk about, like, there's wizards and there's system managers. Mike and I are just regular old system managers. This guy's a wizard. He's a Jedi. He literally, we were at a course working together, and I don't know, he literally just cupped his hand over my shoulder gently, and my low back pain went away 30 seconds later.
He's a healer.
He seriously is a magician. So Bernard Horn.
We got to do this every day, guys. This is the best day ever.
Put this on a loop and play it for your wife, Bernard.
Yeah. Can you please? We should have had her on the podcast.
Hey, you're still going to have to take the trash out later, buddy.
Yes,
sorry.
Yes. 100%. This morning, actually.
So Bernard Hornbosch, and if I screw up that name, I apologize.
All good.
But he's the founder of Fit to Train Human Performance Systems. He's in Vancouver, British Columbia, and he works with anybody and everybody. He's the director of physical therapy for the Vancouver Canucks. He's worked with NHL, NBA, MLB, NFL, CFL, MLS. We met him through Functional Movement Systems, had the honor of teaching together many times. Again, every letter you could think of, but one of the things that's going to be unique about today is that he has his Bachelor of Human Kinetics in Exercise Science, his Master of Physical Therapy, his degree in Osteopathic Medicine, manual practice, and osteopathy. He's also CSCS, orthopedic manual therapy, and then also acupuncture as well. So getting all sides of the spectrum. So, and that's in addition to being an absolute magician. And so, Bernard, we are super thrilled. It's been too long since we've seen you, my friend.
Absolutely. Thank you so much, guys, for having me. This is, I was looking forward to this morning.
Well, we're gonna have a nice conversation today. So we're gonna dive right in. All right. So, patient gets referred to your clinic by their doctor, and they're given guidelines, restrictions. Hey, no squatting, no lifting over 5 pounds, which is generally arbitrary numbers, right? How do you handle that while staying within doctor's orders?
Yeah, I think, and honestly, this happens to us quite a bit. And I think just with the tools and the systems that we have in place, we all come from the functional movement systems background and stuff like that. I literally start, I get them off their feet, put them on the table, and I get some information and data for the doctor. And after doing my detailed evaluation, I try and engage with their physician. At least in Canada where we are, you kind of have to follow the medical directions. But a lot of times it's not about, the doctor, at least where we are, doesn't have a lot of time with these people, you know, so they're giving these generalized recommendations of like, you know, this is what you need to do, this is what you need to stay away from. So I try and, you know, engage with the doctors and educate them, and at the same time educating the patients. And I'm not putting the doctor down ever or saying, oh, they're wrong, they don't know what they're talking about. But I think, you know, physicians in particular often don't have a lot of time to do a thorough exam, and often the recommendations are based on imaging, or you know, the patient sits there and they're describing their symptoms, and the doctor is really trying to get symptoms out, right? Most doctors, whether they're prescribing medication, whether they're, you know, they're just trying to get people out of pain. And, you know, we start going down the route of like, okay, well, you can't squat. Did they tell you not to sit on the toilet as well? Well, you can't squat. Did they tell you you can't sit in a chair? Do they mean like you're not allowed to descend down and you need two people to hold you at all times? Or, you know, and so we start to educate around how we can get around things. Um, and often, you know, I have a good relationship with a lot of doctors, and when you speak with them, their, you know, their idea of squatting is their person going in the gym, putting a bar across their back and, you know, loading it with as much weight as they can, and pushing through. So we, you know, and having access to movement screening, and, you know, there's a lot of different things we can do. And you know, so I think that's how I get around it, is one, educating the patient, but also trying to engage the physician in it. I, again, never say like, oh, your doctor's wrong, or they don't know what they're saying, or because at the end of the day, and I think it's even worse in the States, if something happens to that person and you're going against the physician's recommendations, then you're in big, big trouble, right? We all know we can teach people how to squat on their back. We can teach people how to squat on all fours. We can teach people how to squat in a kneeling position. Um, and you know, the cool thing with some of our systems is, okay, well, let's take that movement pattern out. I've got a bunch of other stuff that I can do with you. And at the end of the day, you know, whether you're a clinician or strength and conditioning coach or whatever, that's versed in the, you know, movement quality world, if you can do something for that person within the boundaries that makes them feel better, usually I find doctors start listening. So that's how we get around it.
A big thing that we need to consider is perspective, and also kind of, you know, what the downstream effects of some of these things can have. Perspective being they're always going to have a higher regard for the doctor than they are for me, just some trainer, some strength coach, right? And so, and as you said, in certain aspects, I need to stay within that lane for you know, just scope of practice and everything else, and need to remain professional. So I'm not saying to veer out of that whatsoever, but also putting in perspective the fact that, okay, how much training do you think your doctor got in exercise and movement? And they'll be the first to tell you it's zero, 0.0. And I say he got as much training in exercise as I got in medicine. And so if you're sick or ill or have a disease, please don't come to me to fix it, but don't go to them with your exercise problems at the same time. And so we have to have the perspective of that. And then the downstream effect is that even if some of these things are said with, like you said, good intentions of just giving people some guardrails, I don't think they understand how that sticks, and the scarlet letter that they put on some people, where they kind of label these patients with this diagnosis or prognosis, where it's create these limitations that can sometimes do more harm than good. I was at my facility the other day, and just I was standing at the front desk, and I heard two women standing by a treadmill just kind of commiserating with each other and saying, talking about, well, my back and my hip and my knee. Well, my doctor said I could never run again. Well, my doctor said I should never squat. Well, I can only do the treadmill. Well, I can only ride the bike. And it's like these poor women have been put in such a box where that's a really tough way to live. And it makes them insanely fearful of movement in itself.
Well, that's, you know, I had to get over, you know, I used to fight this stuff all the time. And I had to remind myself that whether you're a coach or a clinician or a physician, everyone at the end of the day has the person's best intention in mind. Like they want to, they're not saying, they're not putting up these blocks to like harm them. They just want them, safe is not the right word, but they want to do their best for that person. And, people walk around feeling like they got a ticking time bomb inside them. And, I think, the number of clients that come in that have imaging, for example, I'll use imaging as an example. And, my doctor said I've got like 3 herniations in my back. Let's use that. And I'm like, like, did they actually go through the MRI with you? Like did they read the report and explain? Did they pull out the model and stuff? And 10 out of 10 times, the answer is no, right? The MRI report was like passed on to the person in a 2-sentence comment, So then, the first thing I do is I literally pull up the report on my screen and we go line by line. And like radiologists, for example, have different language they use. Mild, moderate, severe. You have mild degeneration, right? How old are you? 63? That's pretty damn good. So there's some success there, right? But the number of times that like when people realize that, so if I don't have to worry about the way I sit and stand or take a step, or like people literally have this, like, it's almost like they're duct taped in life. They don't want to breathe the wrong way. They don't want to it's so changing their mentality that like, look, like you don't have a ticking time bomb inside you right now that's going to blow up any minute. And if you did, trust me, you wouldn't be in my room here. Your doctor would check you into the hospital, And when we change that mentality, and I think on the physician's defense, I have realized that our people, our clients, sometimes, communicate, something completely different than what the physician's intentions were, because that's you're taking their word, not, the physician didn't stand there and say, I don't want you to do this and this and this. And I bet you anything, if you had an opportunity to be in the room with a physician and would have a dialogue, things would be very different.
So I have bracelets that I have because a lot of the one segment of the population that I kind of focus on is guys over 40. And I have bracelets that I give to the guys that they wear, and it says, "You're not broken."
Yeah.
And I make them wear, and because we've made people kind of assume that they're broken. And it's not just these guys. I had an athlete come to me. He was like a Division I football prospect, and as I was evaluating, I know he had this kinesio tape up his Achilles, and I said, "What's that about?" And a dad butted in. He said, I forget, it was a chiro physio I went to. He said, word for verbatim, he said they told him, if you don't keep that tape on, you're fucked. And I'm like, really? This kid who squats 300 pounds and who moves like you're going to tell him everything's going to crumble if this kinesio tape breaks down and falls off.
Yeah.
Like that's
awesome.
that's fear mongering, right? And so let's switch gears a little bit. Let's look big picture. So with your unique background, this is why I was really excited to talk to you about this. You have the credentials to look at any given situation a lot more holistically than most. And so what are like some of the clues that you look for when you have this musculoskeletal problem that may actually be downstream from something that is not structurally based, such as nutrition, lifestyle, capacity, or even a deeper medical issue?
Yeah. And what's interesting, a few years ago, I actually had to make my initial intakes 90 minutes instead of 60 because, the cases were getting a little bit more complex. And I realized the value in actually taking the time to kind of like explore the different parts of wellness, and you hit it on the head. Like, for example, I don't know if people ask about sleep. I can confidently say about 7 out of 10 people that I see don't sleep well. And that's anywhere from like they can't fall asleep, they can't stay asleep, they sleep too much. And the obviously the one that's the biggest problem is not enough. Or they sleep but they don't see the problem with like getting 8 hours of sleep and waking up in the morning and feeling absolutely gassed, right? So yeah, there's a lot of things that, I mean, I've had a handful of cases where we didn't even get off the chair to go do our movement or orthopedic assessments. And, I have the luxury of people coming to me because they've tried a whole bunch of other stuff. They come with a binder usually, and they're like, I've seen massage, chiro, physio, acupuncturist. I've done this, I've done that. And often, like, when I see some of the names of people that they've been to, and I'm like, oh my God, like those people are actually awesome. And it's usually, and I think you guys have heard Gray say this, like the wrong tool at the wrong time with the right person is not going to work, right? Um, and it's the combination of the way they've been doing things, or this person had a frozen shoulder, but also they're diabetic and they don't sleep, and like that's going to impact. I had to go and get naturopathic physicians on my team because I wanted blood work. People would come here. I'm like, I need to know if you're on fire. Because if I'm going to go out there and give you some more movement-based exercise, if I'm going to stress your body physically and you're going to light up, I need to know that. Is your prescription going to be a smoothie and a nap? Or do we need to get you off your butt moving more? And sometimes it's like the number of like Spotify, like vagus nerve stimulation playlists that I've sent people. I'm like, hey, take those earbuds, put this in, and before you like get out of bed, I want you to listen to this thing just to like calm the system down. Your cortisol levels are like through the roof at night and they're non-existent in the morning. Like, so all those things matter. In osteopathy, we look at the body in 3 different layers. We have the structure. So that's the musculoskeletal system, the bones, the muscles, the joints, all that stuff. Then we look at the fluids, right? Whether it's lymph, whether it's blood, whether it's like, and now we're getting a little bit woo-woo here, but like emotions live in the fluid field, right? So like people that come here, and I don't know, the practitioners that are listening to us, sometimes like you're doing like hands-on treatment and all of a sudden the person like literally starts crying on the table. You see that a lot with like acupuncture or any kind of like deep tissue work, or somebody gets like a lymphatic drainage massage and they have this somato-emotional release. And this doesn't have to be like, like a lot of grown men that like haven't cried in years and years and years. They're like, literally, they tear up. In osteopathy, like when we get our hands on people, we're kind of like tuning into their, vibration. And you can like the vitality of the person in our hands. It's like, okay, is this coming from like stress? Is this coming from something chemical? Is this coming, so a lot of different components play a role, but there's a lot of times where we don't even make it to the table or for the assessment, because when I ask the nutrition question, when I ask the sleep question, when I ask like just their medical history, and one thing that I've started slotting in, and these are the cases where like the husband is there because he's had 20 years of back pain and the wife is in the room with him. That's a red flag for me. And the wife is answering more questions than the husband, right? It's like, oh, come on, Jim, tell him, you forgot about this. And like, she's leading the way because, and you sit there and you go, oh, like this guy's back pain has actually like influenced his tribe. Like the family's now getting pissed that this guy can't get off the couch or can't get the garbage out of the house or can't go on vacation, or like now they're retired and they want to go to Europe and walk, but he can't do that. So the psychosocial component and how that influences everybody around is important.
And to that point, Bernard, we see the same thing with young athletes when you have the overbearing mom or dad who's sitting next to them. And then you have to ask, in a private moment with the athlete, is this really what you want? And find out that, they're doing this to just shut up mom and dad, and they don't care about going pro or Division I.
100%. And it's interesting too, thankfully seeing like clinical counselors or psychologists or, the people that can help on the, mental health piece has gotten a lot more popular. Whereas I think a decade ago, like even if you went and seeked help from a counselor, like you didn't talk about it. But now that's a little bit more common. But when people come into my space, it's almost like it's just like they are ready to just puke all the stuff that I've been holding on to because, I certainly create an environment where I'm like, look, like all of these things matter. You know what I mean? Like if you're constantly in fight or flight, that is not an environment. Like I usually, if you want to grow a tree, you plant the seed, right? Like the best seed that you can find. You plant the seed. What do you need? You need the soil. You need the water. You need the light. Well, if you have a tornado coming through your yard every other day, like it's just not going to happen, and some people, I had a fitness person yesterday that I saw, and she was an Olympic level track athlete, right? So she's been in high performance situations and stuff, mother of two, career oriented and stuff. And we keep dealing with this recurring like hip, back, calf, stuff that like doesn't make sense. It's not how we like change the training. It's not how. And I just stopped and I was like, how's your nutrition? And you know what the answer was? Oh, yeah. Sometimes I just don't eat. Like she'll go like 12 hours without having a meal. Or when I do eat, because I don't have time to prepare food or whatever, because I'm I'm running around on the road, this and that, I just grab a bar and like whatever. But it was like a moment for her to just stop and go, oh shit. Like I'm preaching this to my athletes. I tell them how important the fuel and it's like I think nutrition is overlooked. Nutrition not only affects like, the bad stuff obviously blows your body up with inflammation, but also like your hormone regulation gets impacted. Your recovery regeneration is impacted. Your energy levels. Like I can go on and on and on. We actually just added a holistic nutritionist to our team. And holistic because not only we need people to have better nutrition information, but they actually need to be coached. And that's what I didn't realize was a holistic nutritionist isn't just somebody that like has a little bit more fancy stuff that they can add to your recipes. They actually coach people to change their behavior. And that was a piece that I'm like, oh my God, So when you come with an acute injury, to me, yeah, I can do the stuff on the table. But I'm like, how are we going to set this body up to have the best chance to thrive? We had an NHL goalie that had meniscus surgery. He had a cleanup, and he got back to hockey in 2 weeks and 2 days post meniscus surgery. Meniscus repair, 2 weeks and 2 days. We hit him from every different angle. We had him on the table getting lymphatic drainage to drain the system, to get rid of all the toxins and the crap. He was getting ozone infusion for the systemic anti-inflammatory stuff. He was getting osteopathy. He was getting Chinese medicine. We cleaned up his nutrition. He had a very good biomechanics person that understood what they were doing to the point where I'm like, you know what? This guy is actually better than I am when it comes to the movement stuff. And I don't know how much hockey you guys watch, but goalies are a whole other world.
Oh, they
just like the body should not move that way, And if you haven't had multiple hip surgeries as an NHL goalie, you're not in the NHL, So all these things, yeah, like I can't. The more we learn about the ecosystem of the human being, and I'm not using the human body, the human being. I actually don't think there's a difference between the mind and the body. We call it mind-body connection. There is no difference. It's the same thing. I mean, to the point of like your skin is ectoderm. And if you know like embryology, ectoderm is your brain. All your nerves are the ectodermic layer. So it's, I think like the best practitioners, the best coaches know how to tune the nervous system. And then you watch everything else. I mean, movement is nervous system. Attitude is nervous system. Sleep is nervous system. Digestion is nervous system. Everything you talk about. So that's been, and we've grown to about 17 different practitioners. And The only thing I don't have on my team is a clinical counselor. And the reason for that is I think sometimes like you need a certain personality for certain people. So we refer a ton. So I shouldn't say we don't have somebody on our team. We have a big network of mental health people that we work with, but it was out of necessity, you know? So hopefully I answered the question.
No, excuse me, absolutely. So, obviously there's so many different ways to assess individuals, but having a thorough assessment process really helps minimize guesswork. But even at its best, sometimes it's just giving us a little bit more of an educated guess. So when you start to do your interventions based off of your findings,
Yeah.
When and why do you sometimes question your assumptions from what you actually found in the assessment?
Yeah. So inconsistencies in the findings, and it's interesting too, like when I was going through my osteopathy training, I quickly realized that osteopathy was or is the SFMA, right? That's what osteopathy is. It's a system that doesn't bias, and whether you're coming with a sore back or a sore ankle or pain in your gut, we literally go and check the whole thing. If somebody has, and for people that are familiar with the SFMA, and I'm using the SFMA because it's the clinical, say like someone comes into my space because they have pain, and then they come in and they go, I have neck pain. The practitioner that runs the SFMA properly doesn't say, oh, you have neck pain? Oh, I just need to do the shoulder and the cervical patterns. I'm going to skip toe touch. I'm going to skip extension. I'm going to skip single leg stance. I mean, the number of times that the client's like, I came to you with neck pain. Why are you checking my balance? And that's the first and the last time to ask that question, right? So when we go through the process with no bias, and I always say I'm doing all of this stuff because I'm not smart enough to like figure out exactly what's going on, right? When we go through the process and you watch them move, then you put them on the table and you go through the parts, and then you start to find inconsistencies. You know what I mean? Like your extension is terrible, but you've got your modified Thomas test is amazing. Your lumbar lock rotation is amazing. I do all my motor control testing, and you actually, I don't. What do you say to them? Oh, just go. Your problem's coming at capacity. It doesn't work like that. And I guess like because I'm like tuned to that sort of area, there's a lot of people. I've picked up people that have had kidney infections, low grade infection, and when you have a kidney infection, what it feels like is back pain in the upper part of your lumbar that kind of like gives you a bit of weakness in both legs, right? Oh, my hip flexors must be tight. You lay in bed at night and all of a sudden your hip flexors cramp up on you. Like, how is that possible? You're not against gravity. A lot of like digestive issues, a lot of like, people think it's normal to have a bowel movement once every 3 days. I had one person come in and he's like, yeah, my QL on the left side, it's tight. I needle it and it helps for a couple days. And I do all these stretches. Like he had just been attacking this thing from an MSK standpoint. He went and cleaned up his diet and they actually like, I think he did some testing and they found, can't remember exactly what they found, but he had to go on antibiotics. He had to go on antibiotics. And as the antibiotics were doing their work, the QL stopped barking, the back pain started getting better. He came here because I saw him for an eval and I was like, this just doesn't smell like something that like I could help you with. And just basically because the last 3 months this guy had spent like working with chiros and physios and strength coaches and exercise specialists and all that stuff. And I'm like, to be honest with you, like, I don't know what I can offer you except, and luckily he had already explored. He was working with a naturopath that was doing some blood work. So they're waiting for the results. And before our next appointment, he called and he's like, hey, they found a bunch of stuff. do you mind if we push our session a bit later? And I'm like, absolutely. And and he called me. He's like, oh my God, I'm on day like 6 and my pain has gone down 70% already. Right. And now a lot of physicians would have dealt with that with, oh, just take a couple pills here, you know, and I get people that like take their pills as, you know, we call them vitamin A, Advil in the morning as part of breakfast, just to control the pain throughout the day. Right. And, you know, when he came, he's like, hey, like, actually, like my pain is like a 1 out of 10. And then I'm like, you know what? Okay, let's do a proper movement evaluation. And we found a bunch of stuff that needed work, that needed like some quality control so that, and this guy loves to climb mountains, loves to get on his road bike and go for, you know, 3-day bike rides and camp in all different areas and stuff like that. So it's not that I'm not going to do the physical work with him, but when there's something, when your gut is on fire, you know, anything I do is not going to make a difference. And a lot of times, good manual therapy, good exercise therapy gets dismissed because it doesn't show the results because there's something else that's the low-hanging fruit.
Trainers, listen up. If you're tired of losing clients, feeling burnt out, or just second guessing your programs, it's time to stop winging it. Join us for the Forever Client Formula Challenge, a free 3-day experience where we'll give you the exact blueprint of the top 1% of coaches so you can build loyalty, retention, and a thriving business. You'll learn how to clarify your vision, connect with clients, and build programs that scale. Spots are limited. Sign up now and start turning one-time clients into forever clients. Register now at foreverclientformula.com.
Now, I hope everybody listening is picking up on a couple things that I notice is a trend. We're, 100 and, 60 something episodes in, and the brightest minds that we've spoken to all have the common things that you're hearing from Manad. One is they're not afraid to say, I don't know, right? It's the more comfortable I get in my own skin doing this, the more comfortable I am saying, I don't know. The more comfortable they are to not be the answer. Right? Like you said, hey, if this naturopath's got it, go for it, lean in. And then the third thing is not afraid to test your work. There's some people that will bash assessment and so forth. And I think some of it is because they have their own agenda of their test is better than our test, which is fine if you want to have that argument. But if you're arguing that doesn't have value to test, I think you're scared to test your work and see if it actually happens. And so, in terms of seeing if it is working, one of the coolest things that experiences we have in our live courses is when we do a live case study. We'll present a case study like we're going to do in a couple minutes. And then we break the room into 3 groups and they all go to whiteboards. They each have a team captain and they put together a program for this individual. Then we go to each whiteboard and look at each program. All 3 programs, all will work. No one disagrees with any of the programs, but they're all vastly different. Right. And hence the name principles. That's what we go by. Like the principles were the same, but how we implement it was vastly different. So with all the clinical tools and interventions you have as part of your kind of personal skill set, how do you even begin to narrow down given on any given situation, knowing that a lot of these things could quote unquote work? How do I pick which one I'm going to even start with?
Yeah. And that goes back to the individual as well. Are you dealing with a high school athlete or are you dealing with a single mom of 3? Are you dealing with somebody who is educated and has had a lifetime of like taking care of their health? Or, are you dealing with somebody that's seeing a physiotherapist for the first time? I think like a lot of people out there have the perfect program, the perfect therapy, the perfect package. And like, it's like if that person you're implementing it on isn't ready for it, like when we go like evaluation and if you do your work properly, it could be like quite overwhelming for people, and it's a lot of it is like test, try, get feedback. And I think like my thought is always like less is more. And sometimes, you know, if we're going through the evaluation and we're doing a manual intervention, I might not necessarily prescribe the movement piece right off the bat because I want to get some feedback on what that individual component did for this person, right? Because it's pretty cool when you like, let's say somebody comes in, you do some sort of manual work, and let's say they feel better, right? And then they go away, but 2 days later, that better went from like a 100% better to now it's back down to about 60, 70%. And then the next time you see them, you reevaluate and you do an intervention. Now you go, now, you know, here's a tool that's like pressing save on a document, right? And I always say treatment is about 10% of the whole picture. Treatment is a window of opportunity. Treatment doesn't fix anything. The only treatment that fixes people is surgery. Outside of surgery, all other interventions that are clinical outside of exercise are short term. Okay. It's very rare that you do something without the addition of some sort of like movement re-education or training, which is like where you guys come in. It's short term, right? Or that wasn't the problem. And then they come in and then you do your physical intervention. And then now we get to press save on a document with some movement intervention, whether I teach this person how to get on the floor and control the body from right to left, whether they get in on all fours and actually be able to like separate shoulder from the hips or whatever movement component that we feel they need, you know? And then you kind of go, okay, like I'm going to give you 2 exercises, not 10. Unless they're, you know, their job is to go and do this stuff. So pro athletes, you know, or they have a contract looming and they're like, give me more. Those people want to drink out of a fire hose. Whereas the person that's like, I'm like literally an Uber driver for my kids. Like I have about 10 minutes a day before somebody needs something from me. And you have to make it work. You can't cop out, you know, and I see people come in with like booklets of exercise that like, I bet you anything the clinician didn't actually go through the exercises themselves. If people were to do the sets and the reps and all the exercises, it would take 2.5 hours. Well, who has that time? You know? And if you need 2.5 hours of corrective stuff, then you're definitely missing the problem. You know what I mean? Like you're definitely missing the problem. So I think in order, like how we pick the right tool, the right treatment, the right exercise, the right intervention for people, you know, on one side we collect a lot of information, but on the other side we sit down and go, who do we have? You know, there's a human side to this. You know, is this Mrs. Smith that's in her late 70s, or is this, you know, are we in the championships of the high school basketball stuff? And maybe I need to do more treatment and less intervention on like that they get to do on their own because there's time is of essence. Sometimes like I don't want to make people feel good fast because they won't get the lesson in the fact that like they abuse their body and that's why they're here. You know, people take all the supplements, but they also crush 3 bottles of wine every night. Like that's not okay. So it really, for me, depends on the person and you know, the resources. If somebody can't afford to come and see me as much as they should, then it's like heavy on the education side, you know, give them a little bit more stuff that they can do at home. You know, there's certain modalities out there. I'm a huge fan of red light therapy. I'm a huge fan of like having some tools that they can like build a little intervention toolbox at home. And it's kind of cool too. You're empowering them with the tools so that they can be part of the process. That's how I would go about it.
All right. So now comes the fun part. This is where we're going to do a case study. And when we put together the case studies, Mike and I will go back, or sometimes the clinician will bring the case study. Bernard specifically said, I'm not bringing one because I don't want to be biased in it. So ironically, the universe in its magical ways brought me the perfect person yesterday. Okay. And I did an assessment with this woman, and she's a perfect case for kind of the theme of today, and that she's a little bit of a mess, but it's by our doing. It is our collective fields of medicine, rehab, and fitness that have screwed this person up, and you'll understand why when we go through the case study. So let me give you a little background on Donna. The names have been changed to protect the innocent. She's a 56-year-old female. Her primary goal is to improve body composition, right? She doesn't like the way she feels and looks. You know, that menopause has done a kind of wreaked havoc on her, but secondarily, she wants to just improve her health and vitality. She has two grown children. And most of all, she kind of hurts all the time. She's got this litany of injuries that she's dealt with over all the years. Let me give you a background on these injuries and see if you pick up on a theme here. She has a left knee issue. That's her primary thing. Last fall, they said it was a possible meniscus tear, but didn't say it warranted surgery. She hurt that. She was doing bar classes. If you're not familiar with bar is one of these things that in its truest form probably has some really good value, but once it gets bastardized and commercialized and then sold to, you know, rich suburban women as a way to think that you're burning body fat, or you just do thousands of reps to get super, super tired and sore. That's what she was doing. And now her left knee's all jacked up. Her low back, she injured that while doing burpees in a boot camp class.
Oh.
Her left shoulder, she injured that while doing an overhead press in a boot camp class. She sees a chiropractor about a few times a year, which it gives her some temporary relief, kind of all this going and themed with everything Binod's been saying. But here's the biggest thing. She told me flat out, usually you have to insinuate this, but she told me flat out, she's scared to move. Thanks to all that we have done for her collectively. Now, her medical history, other than that, she has high cholesterol. She's not taking any medications. She's told her doctor she wants to try to manage it with diet and exercise. She does deal with a little bit of anxiety and depression, so she's on a low dose of Lexapro. Lifestyle-wise, she works a very active job managing a healthcare facility. She showed me she logs on average about 10,000 steps a day. Okay. Sleep. I had her rate herself in the three following what I call the big three. Sleep, she gives herself a 7 out of 10, even though she says some nights she struggles with stress and kind of ruminating thoughts and getting to sleep. Nutrition, she's a total stress eater. She soothes herself with cookies every night, and she has a sweet tooth. Stress, it varies based on, you know, different times of the year and if she has projects or things she's doing at work. And some overall testing notes. When I asked her to squat, she had a significant shift to the right. Not something to be, not something surprising. If your left knee hurts, your body's going to run away from it. But as soon as I elevated her heels, the shift went away.
Did she have pain with the squat?
She did, but not as she did it. She said afterwards, now I feel my knee. Okay. Her ankle mobility was restricted, but significantly restricted on the left side. Again, shocker, that's the side where the knee hurts. I said, has anybody in all these people you've seen ever even looked at your ankle or asked about your ankle? She said, no. She goes, but that makes a lot of sense. And so then we looked at her single leg balance and a lower body motor control. She fails on her left side, shockingly. It created a little bit of discomfort in her knee, and she's about 2 inches shorter with her reach on one side than the other. Her core tests, both stability and coordination, and a push-up and a rotary stability test, both ones, terrible. But no pain on any of these tests other than the little bit of discomfort in the knee when doing the squatting and the single leg balance. She also told me, just in passing, oh, my mobility's terrible. They told me my hips are super tight. Her leg raise, 2s, passable. Shoulder mobility's 2s. Actually, it might even be a 3 now that I think about it. When I tested her grip, it's on the lower end of average. So now you start to kind of create this archetype of who this person is. But the big thing is, like, we did her wrong. This is a person who went to a facility and paid money to get fit, and ever since has been a downward cascade, and we're to blame for it.
Yeah, you know, and immediately you want to like fix her knee and fix her back and fix like and this to me is, you know, immediately what I'm thinking about is like this person, I wouldn't be surprised if she's pre-diabetic. You know what I mean? Like that the stress and the stress eating and the cookies and stuff like that. When you have an injury, it usually hurts with movement. right? Not necessarily like when somebody says I'm sore everywhere, everything hurts, whether it's my shoulder, my knee. Now it's easy. Like the number of people that have torn meniscus or bulging disc and stuff that are walking around out there are quite active without any symptoms. So I'm not like necessarily jumping on those. And you know, if you can squat and go through the movement without pain in that knee, but it hurts after, that's not as alarming to me versus somebody that like descends and goes, ouch, there's a stabbing pain. Meaning we can do a lot with that. Now, did they suspect a meniscus injury or did she have an MRI or imaging?
No, they just on physical exam said, I think you have a meniscus tear, not worth doing surgery on based on the fact that she's not going to go play a
Yeah,
sport or do anything to challenge it. So,
yeah, yeah. So yeah, I wouldn't even take that diagnosis, right? I would chalk it up to meniscus injury to me is worth, you know, zooming in on if the knee's locking, catching, stabbing pain, and even then, a good manual therapist can realign the tibia and the femur. We manipulate the meniscus, and we can like every knee injury has a shear factor with it. Every ACL tear, every MCL tear, somebody needs to go in there and adjust the tibia relative to the femur. And sometimes it's the tibia needs adjustment, sometimes it's the femur. So good clinicians need to differentiate between that. So that's besides the fact, but this person, for some reason, my head is just going like, how do we clean up your nutrition? She doesn't need to be on a diet. How do we clean up your nutrition? And the low-hanging fruit for me here is like, I would be, depending on how much she's open to it, I would dig in a little bit more into her the social factors, right? Why do you have high stress levels? Is it like financial? Is it relationship? Was there a death in the family? Like those pieces really matter, right? So I would push a little bit more onto the psychosocial factors, for sure. I would really lean into the benefits of like cleaning up the nutrition part. Here are the foods that, you know, and to the point of like, you know, I use my knee injury. I think you guys have heard about my knee injury. So 2013, I was skiing and I had a fall and I blew everything in my left knee other than my ACL. For some reason, my ACL didn't go. It was a dashboard injury, so full PCL, MCL, LCL, both meniscus. I tore my gastroc heads, and I got the only thing outside of like the therapies that I'm gonna tell you about was I got some stem cells. So they took some cells from my abdomen, fat cells, and I had a stem cell injection. Outside of that, I took no anti-inflammatories. I'm very, very against anti-inflammatories unless it's life and death. Anti-inflammatories change the body's natural healing mechanism. And if any doctor wants to come and go up against me, I will go against them all day long. Okay? Now, I'm not saying like having turmeric in your diet is a bad thing, but if you're going to chemically give me something that I put in my mouth that changes my physiology, I think it prolongs the healing. Okay? So I got back. This was a 14 to 18 month process. Standard rehab. I was heli skiing, dropping out of the helicopter, ripping down like 6 feet of powder 9 weeks after this injury. Guess what I did? I stopped drinking alcohol. I took all sugars outside of like fruit and vegetables out of my diet. I leaned into my sleep. I started like meditating. Like I got the nervous system lined up. Obviously, I have the physical exercise background. I've got access to, you know, the therapies. Now, do you think I was treating the knee? No, the knee blew up. The stem cell was going to take care of that. I cleaned up my ankles. I cleaned up my hips. I cleaned up all the stuff. It was interesting. For the first time, I had time because I couldn't do anything else to clean up my body. I gave my knee the best environment. Everything that attaches to that injury, I like zoned it into it, right? I worked on my motor control. I worked on and then the strength and the power and all that stuff. Now, am I saying that everybody that has traumatic injuries should get back and be stupid like me and do crazy stuff 9 weeks after? That's not the point. I had a dancer who has just got diagnosed with medial tibial stress fracture. And the sports medicine doctor says it will take her 18 months to get back to dance. Like, what are you thinking right now? I'm like, are you kidding me? A 17-year-old girl is going to take 18 months to get back? Yeah, if you follow like the way, shake and bake medicine is practiced. So for this particular client, for Donna, my spidey senses say, hey, like, lean into her nutrition. That like when somebody says, I'm always sore, right? A meniscus tear shouldn't be sore if you're sitting, if you're laying down, if you're not being active. Your back shouldn't be sore all the time. Your shoulder, like these so-called injuries should bother you when you're physically pushing yourself to certain limits. I'd lean into I try and get those stress levels down. And I get it. Exercise for a lot of people is a stress reducer. But I'd heavily lean into the nutrition side of things and say, hey, give me about 3 weeks and follow exactly what I say. If you don't feel amazing, then go back to whatever you were doing. But 3 weeks of and when you give people a specific plan and you have a start date and an end date, don't take a sip of alcohol. I'm not saying a glass of wine with dinner, like 0. You have to go extreme. You have to go extreme so that they see the benefit. I mean, I took ketchup out of my diet. Like anything that wasn't going to serve me came out. It was an experiment. Now, I've gone back to a lot of the stuff that I took out. I'm not saying you still got to have some fun and live life, but my goal, I paid X amount of money and I needed to get there by a certain time. And then when it comes to, the physical components of Donna, I mean, I think you and I know when somebody has so many problems, but they have double 2s on active straight leg raise and potentially 3s on shoulder mobility, I'm going holy shit, this person has a good package. The base is pretty good. There's just a pile of shit on top of her, right? It's when you get this case and it's 0s everywhere. 1's on the leg raise. 1's on the there's a lot of stuff we can do. Out of curiosity, does she have pain when she goes for her walks?
If she's on her feet for a long period of time. And that's always kind of one of the clues as well when I ask people is does it start at almost like you're saying, does it start at the onset or is it after a long period of time? Because that may lean me towards a little bit more of a capacity issue than, okay, we have something we need to fix here. And it's only after she's done a long day that she'll feel her knee kind of achy afterwards.
Interesting enough, Eric, I have this exact case. Literally, I have this exact case.
Well, I've seen Donna, and I've seen probably 30 different versions of Donna over the years.
Well, and you know what's funny? And I shouldn't say this, but my lady's name is Donna. In fact, she's in her early 60s, and she didn't come to me and say I need to work on my body composition, but everybody in the room knows that she needs to work on her body composition. And I said to her, look, when we walk, X amount of the force and ground reactions coming back at you. As I increase, you run 8 to 10 times your body weight is slamming back into you, right? And she wanted to be physically active and do this stuff. Her issue was they're both husband and wife are now retired. They got grown kids. She's a little pissed that she has to now take care of all the grandkids. She's like, I didn't, I had my kids, and the kids are leaning on her. But her issue is now her husband wants to go do things. He wants to travel. He wants to walk. He wants to golf. And she can't do any of this stuff, right? Because she's afraid she won't be able to keep up. She's afraid she can't walk for prolonged periods and stuff. So we started, and just so that she feels like she's doing stuff to fix her body, like I got her blood tested, we put her with a naturopath and all this stuff. And the naturopath's like, yeah, she's pre-diabetic, like 100%. But interesting enough, she challenged us, and she's like, well, I'm not ready to make all these changes when it comes. She's like, I feel like I have a good diet. I feel like I eat good food. I feel like, so I uncovered something, but she wasn't willing to lean into it. So then I switched gears. I went, okay, these are the reason. This is how like emotionally we can affect our body. And I literally went to this whiteboard behind me and I started drawing the cascade and how the brain changes the gut and how the gut changes inflammation and how it affects different parts of the body. So I lean into that. She was a little bit more receptive. And you know what she says to me after the third session? She goes, I used to work with this really, really awesome clinical counselor. I should give her a call again. So that process started, right? And I wasn't like, oh yeah, totally, like for sure, go. I was like, oh, cool. It's awesome that you have someone. And I, just secretly didn't like get excited about it because I wanted to have her moment, right? And then we literally tried to figure out outside of these corrective exercises. Now, you know me, I was cleaning up the ankle. I was cleaning up the hip. I was cleaning up, like there was a lot of stuff similar to your Donna. Like somebody needs to treat that ankle, right? Somebody needs to figure out why this back is suffering, why there's the weight shift, why there's a lot of stuff this person can do on the grounds, right? And we need to find something to keep the wheels turning. So how do we increase her walking capacity? Can she get on a bike? Does she like going into a swimming pool? Does she like trying to figure out what activity turns her on? And what we did with my Donna was when I got her to a point where, and the nice thing was my Donna was very consistent with the 3 correctives that I gave her. It was part of her, like, it gave her purpose in the morning, if you will. She got up, put the pot of coffee on. I've said, when you turn that coffee machine on, you go do your exercises, and then the coffee is going to be your treat, right? So when we got to the point where she's like, okay, but like, I'm feeling a bit better, but I'm still not exercising. What she meant was I don't have physical activity. I'm like, okay, well, what can we do? She's like, well, I'd really love to walk with my husband, but I can't. I'm like, okay, like, you mean you can't like put one foot in front of the other? She's like, no. Like when we go out for a walk, I'm always afraid that we're going to get to a point where I can't get back. And she's like, actually, we've had to call an Uber a couple times. So I'm like, okay. Next thing we do, we pull up her house on Google Maps. I literally had a satellite view of her house. And she lives in this beautiful neighborhood with a bunch of cul-de-sacs. And I'm like, what's the distance from here to here? So we literally measured. I'm like, how much can you do? And she's like, well, I can go from here to here and back. I'm like, how much is that? We're in Canada. She's like, that's 2 kilometers. I'm like, okay, I want you to do 2 kilometers, but break it up into 1Ks twice a day. And then we're going to do another lap and another lap. She's walking 12 kilometers now. And it was like, when somebody can come back from a walk and not hurt, because I believe like you need to undershoot. Yes, you have to challenge the system, but why would you like redline and give them that bad experience? And you guys know, when pain comes, emotions change. There's a whole cascade of events that happen in the body. There's a little bit more cortisol that's released. There's a lot like, so I taught her pain science. I'm like, if you can take, like, don't drink alcohol till you pass out. Stop when you get your buzz. I know it's going to be hard. So that's how we did it. And, she was in her own neighborhood, so she was safe. I learned that she's a person that doesn't want to be on a treadmill inside a gym and just like, where you don't feel like you're making progress anywhere, but in your case, your Donna, again, I'll reiterate, I would lean into the nutrition first and foremost, because as part of the nutrition consultation, one, you're going to clean up her physiology. Two, that gives you access into the psychosocial piece, you know? And let me tell you what else creates inflammation. You know, stress creates inflammation. And, you know, and then I'll start using case examples. Hey, I had this guy, he stopped drinking because he was on antibiotics. And while he stopped drinking for the course of the antibiotics, he realized that his knee pain, his arthritic knees actually felt better. And, you know, and he said to me, oh shit, you've been saying this all along, but like I actually had to go and experience this. So I would lean into the nutrition, which is going to bring in the psychosocial piece, right? The fact that this person is not comfortable, obviously, with their image, you know, body composition. You know, the cool thing is when you know, we know body composition associated with all the like, you know, blood markers and stuff, the cholesterols and the diabetes and all that stuff. And she definitely needs treatment. She needs hands on her in order to feel like there's something happening. Plus, when you send that car out on the track, you want to make sure that ankle is moving because, you know, as you're reading the case study, you're like, well, I think we all know why she's shifting to the right. And we all know why her knee's doing this and her back's doing this. And, you know, anatomically too, one thing I teach patients, I'm like, your body is built in 3 compartments. Top of the head to T6, T6 to L3, L3 down to the big toe. So everything from her, the middle of her lower back down to the toes at the least is involved. And Donna has a shoulder injury. So now that has ruled in the upper half of her body. But that's how I would approach that.
All right. So Mike, I want to get your 2 cents, but the hopefully the takeaway from the people on our side of the fence, Manad, from a training standpoint, is that you have kind of 2 camps. You'll have the people that are just like, well, she's just weak. She just needs to train and just get her training and then a lot of clear stuff up. Well, she did try to train. Well, my training's better. Okay, fine. Your training's magical and it's better. Then you have the other camp that we see a lot of we're partly to blame for. We have the corrective exercise nerds who are just going to give her nothing but corrective exercise where she needs to get fit. So I talked to her about energy system development. I talked to her about, you know, she needs to get stronger. It's like her grip is not great. Like she needs to just get stronger. And really the bottom line is she just needs smart training. Right. At the end of the day, she's not broken. She just needs smart training. The 3 of us here, if we all look at that case study, would you ever ask this person to do a burpee? No. Right. She has pinching on extension, right? Not pain, but just pinching in her lumbar spine and extension. So I'm not going to have you do 100 burpees. That's silly. You have 0 core stability. I'm not going to have you, and you can't even get off the ground and push up. I'm not going to have you do an overhead press. I'm not going to have you do a bunch of lunges with limited ankle mobility. Like all these things are pretty second nature to us, but now we have to go back and be the police that says, all right, as much as we're going to give you things to train, and I could still train you pretty hard where you're going to feel good training, but there's certain things that are going to be off limits temporarily until we can clear some of the stuff up while we're working on your ankle mobility and your core and all that stuff. So Mike, I'm curious of like, what would be like things you would tell her, say, all right, for the time being, these are red light activities off the menu?
Well, there's a lot to unpack here. Obviously, with the fear of movement, right? I think that's something we need to take into consideration. And what I always do is anytime I have people that are scared of movement, and a lot of times that means scared of falling or misstepping, I'll start them on the ground and I'll actually take them through that sort of NDS type style of movement where they feel comfortable doing supine exercises. And then we can get them into those other things. So for me, it's about using the NDS as sort of a guideline to go from simple to complex, but also from a neurological standpoint, you know, we can gently have that conversation with the nervous system so we're not overwhelming it. And we all know what happens when we overwhelm the nervous system. We can get cramping, we can get pain, we can get lots of different sort of, check engine lights, if you will. So, you know, for me, I would just build her confidence, with movements that feel good. But at the same time, I think she also just needs a lot of encouragement that like, you're not broken and that, look, you know, you're going to be okay through this process. Because I think, you know, I look at this stuff and like when I was saying is like, this is like, I look at this and like, from a movement standpoint, this is easy, but it's probably not, it's really not getting to the bottom of it. It's sort of near the bottom, but you still have to dig much deeper.
Well, and then
like the one word that comes, sorry for interrupting you, the one word that keeps coming to my mind is trust. Like, she doesn't trust this world right now because she went and tried,
rightfully
like
so.
her solution, yeah, absolutely. Her solution to, quote unquote, fixing her problem was to go take these classes. Exercise wasn't going to be enough, but a boot camp was going to like get the process done faster. And I think she just lost trust in the system. Kinesiophobia is a thing. Kinesiophobia is a thing. And it lives in your amygdala. It lives in your like brainstem, and the brainstem is the smoke alarm, and your forebrain is the watchtower. And when there's a disconnect, when the subconscious is like saying, this ain't going to be good, but then someone's telling you, well, but I have to go and exercise and I have to go and do this and that. Somebody just needs to say like, hey, like, you're going to be okay. And by the way, we love you. Whatever's happened to you in life, like, we're genuinely, we want to see you thrive and succeed, right? Like, you're not a broken knee or a broken ankle to us. You are Donna, the 56-year-old, beautiful human being, inside and out, right? And let me hold your hand. Like, if you lay this person on the ground and get her to do some breathing and calm the nervous system and take some tension out of her neck and shoulders, and you retest her grip, all of you know her grip strength is going to inch up, right? Not to the point where like now she has enough grip strength, but a test like that is going to show her that like, look at what your physiology can do to you. It can change the number by you just like calming down. Kinesiophobia is a thing. And I got like educated by a client. It was an interesting sequence of events. I've been treating this gentleman in his mid-60s that actually Dr. Chang sent to me. This person lives in Vancouver and had traveled to LA to see Mark, one of our great colleagues. And this guy literally like walked in the room as if he was 110 years old. And he took 5 minutes to get on and off the treatment table. But yet he sat in his car and drove here, And there's a book called The Way Out that I think everybody should read. I can't remember the name of the author right now off the top of my head, but look it up. It's called The Way Out. Actually, let me get the author's name because that would be rude of me not to. The Way Out. Yep, here we go. By Alan Gordon. The audiobook is 4 hours and 50 minutes. A revolutionary, scientifically proven approach to healing chronic pain. This book humbled me. And my client, I gave him this book, and at the same time, he went and saw this practitioner that somebody told him to see that did the Stecco method, the soft tissue release stuff, Stecco method. And this practitioner said, oh, you have kinesiophobia. Now, like, when my client told me this, I'm like, yeah, of course. But I never said that to him. I never said you have kinesiophobia. And that was the key he needed. Now, he's going all the way to the other side. He's like this guy didn't eat pizza for 20 years because he was afraid of what it was going to do to his body. He was like, he tried to get to wellness through fear. If I move too much, if I move too fast, if I do this, like, and he's thriving. Like, it's a different person. He's like, he came into my office and he grabbed a pen and pushed it off my desk onto the floor. And I'm like, what the fuck? And he's like, oh, I just want to show you that I can pick this pen off the ground now. And he just bent right down, didn't hip hinge or anything like that. He just bent down like a normal human being and grabbed it and lifted it up, right? But it's, you know, you have to penetrate your people's, like, I'll call it soul. Like, first and foremost, like, man, you know, that must suck, that like have pain all the time. But guess what? Like, and we all have our stories. I'm here to help you. And I've seen this. And I have X number of other clients that went through the same thing. And let me tell you what happens at the end of the day. I always tell my people, the difference between you and I, not only have seen the light at the end of the tunnel, I've been on the other side of the tunnel. I've gone through it. I know exactly what's going to happen, right? But their subconscious is driving this because they've missed vacations. They've missed their kids' sporting events because they couldn't sit in the chair for long enough. They've impacted other people. And you know, and sometimes I feel like being in pain is a way out of, you know, dealing with the body composition and committing to the exercises. And let's face it, and sometimes, unfortunately, for a percentage of my people, and you guys can relate to this, being in pain gets people to pay attention to you. And a lot of people don't have humans in their life that give them the attention they deserve unless they lay down on the couch. Especially hardworking moms out there that are responsible for the house, for the kids, for the, you know, things are hopefully changing, but like some people just need attention, and pain is a way for them to stop this fast-paced life where they just constantly feel like they're going off the end of the cliff. But I think gaining their trust, and sometimes, you know, I always joke, and I'm like, when you're on the ground exercising, you can't go any lower. You're not going to fall. You're not going to, like, it's like literally the floor will stop you from there. So I agree with Mike in that often I put him on the floor. I take him back to the basics, and I'm coaching them, not just with movement, but like life experiences and how this is going to get better and stuff by going back to those primitive patterns and stuff. And I guarantee that when these people stand up for at least a moment or two, they will feel lighter. They will feel like, oh, there's a little bit less tension. There's a little bit, God, you get somebody laying down and doing rolling pattern, you know, and I say it's impossible to hurt your back by flopping back and forth on the floor. If you hurt your back, we got a way bigger problem. Somebody at the hospital or at the doctor's office has missed something.
So we have to wrap up because we've went way over time. But the two big takeaways I hope everybody listening has gotten is, one is just the power of how much we can impact at so many different levels when it's done right. And two is that there's so many things we need to consider that we're not thinking of. And so the this for that concept that we're all guilty of, oh, you have, you know, a sore low back, you must have tight hip flexors and weak glute medius. If it was that simple, the three of us wouldn't be sitting here breaking down a case study for over an hour and a half. And we haven't even scratched the surface. We could do this for the next 6 hours if you know any of us. So, Bernard, I can't thank you enough for your insight. We'll have to come back and revisit because we didn't even scratch the surface. We're going to have to do round 2 at another time later.
You know, I love you guys, and you know, I love doing this stuff. Thank you so much for having me.
Greatly appreciated. And we thank you all for listening. And this has been the Principles of Performance Podcast. Thank you for listening to the Principles of Performance Podcast. If you've enjoyed the show, please be sure to give us a 5-star review on Apple or wherever you get your podcasts. If you would like to learn more about our courses and mentorship program, visit www.principlesofprogramdesign.com, where you can book a free strategy call with Mike and Eric to gain insight on how to achieve your potential. Also use the special discount code PRINCIPLESPODCAST10 to receive 10% off any of our live or online courses. We appreciate your attention and your commitment to be your very best.